High blood pressure. High blood pressure is one of the most dangerous conditions on Earth, precisely because it can feel like nothing. There's often no pain, no warning, no dramatic moment. Meanwhile, pressure is constantly pushing against artery walls, day after day, year after year, causing microscopic injury. Over time, the body repairs that injury by thickening and stiffening the vessel wall. That makes arteries less flexible, raises pressure even more, and turns the circulatory system into a high-stress environment. The damage doesn't stay in one place. In the brain, fragile vessels can rupture or clog, leading to stroke. In the heart, the muscle thickens to push against higher resistance, eventually becoming stiff and inefficient, setting up heart failure. In the kidneys, delicate filtering units scar, slowly reducing function until the first symptoms appear late, when the decline is already advanced. Hypertension often becomes visible only through consequences: sudden weakness, a severe headache, chest symptoms, shortness of breath, or gradual swelling and fatigue that people attribute to age. The cruel twist is that the absence of pain is not reassurance. It's part of how the disease spreads quietly through the body. Atherosclerosis. Atherosclerosis is the slow construction of a catastrophe. Cholesterol-rich particles slip beneath the inner lining of arteries and trigger inflammation. The immune system responds, cells accumulate, and plaque forms, like a mound hidden under a smooth surface. This process can take decades. Most people feel nothing because plaque doesn't hurt while it grows. Arteries don't have pain sensors that reliably report narrowing, and the body is skilled at adapting, routing blood through alternative pathways, compensating until it can't. The danger is not only gradual narrowing. The most lethal moment is often sudden. A plaque becomes unstable, cracks, and the body forms a clot to patch the injury. That clot can instantly block blood flow to the heart muscle, causing a heart attack, or to the brain, causing a stroke. In that sense, atherosclerosis is silent right up until it becomes an emergency. People often associate artery disease with pain during exercise, but many never experience classic warning signs. The first event can be the first symptom. That's why it's so feared. The disease can remain invisible while it builds the conditions for a sudden, irreversible loss of oxygen to critical tissue.
Diabetes and prediabetes. Type 2 diabetes rarely arrives with a siren. Prediabetes and early diabetes can develop gradually, and the body can tolerate high blood sugar for a surprisingly long time before obvious symptoms appear. During that silent period, glucose is still doing damage. It alters blood vessels, stiffens tissues, and disrupts the delicate lining that keeps circulation smooth. It also affects nerves, especially in the feet, where reduced sensation can hide injuries until they become infections. The painless nature of diabetes isn't just about symptoms. It's about what it damages first: small vessels in the eyes, kidneys, and nerves, and large vessels in the heart and brain. Many people don't feel the early stage because the body has no reliable alarm for rising glucose. Even classic symptoms, thirst, frequent urination, blurry vision, fatigue, often creep in slowly and get blamed on stress, aging, or poor sleep. Over years, diabetes accelerates the very problems that kill: heart attacks, strokes, kidney failure, severe infections, and circulation failure in the legs. It's a condition that can feel manageable or even invisible for a long time, while quietly increasing the risk of sudden, life-changing events. Atrial fibrillation. Atrial fibrillation is an irregular heart rhythm where the upper chambers of the heart quiver instead of squeezing effectively. Many people expect an arrhythmia to feel dramatic: pounding chest, obvious palpitations, panic-level discomfort. But AFIB can be silent. Some people feel absolutely nothing or only vague fatigue, mild shortness of breath, or reduced stamina that they chalk up to being out of shape. The lethal risk isn't the irregularity itself, it's what happens inside the heart when blood moves sluggishly. In AFIB, blood can pool in parts of the atrium, increasing the chance of clot formation. If a clot leaves the heart and travels to the brain, it can cause an ischemic stroke. That stroke can be sudden and devastating, even if the rhythm problem never produced a single alarming sensation beforehand. AFIB can also weaken the heart over time by keeping the rate too fast or too irregular, leading to a form of heart failure. And because the symptoms can be subtle or absent, people sometimes discover AFIB only after a complication, an ER visit, a stroke, or an incidental finding during a routine check. The danger is built into the silence. The rhythm can be abnormal for months or years while the stroke risk quietly rises in the background. Colon cancer and precancerous polyps. Colon cancer often begins as a polyp, an abnormal growth on the lining of the colon. Polyps can sit there silently for a long time. They don't typically cause pain. The colon is designed to stretch and move material forward. Small changes can exist without triggering noticeable sensations. That's what makes the early phase so deceptively quiet. As cancer develops, early signs, if they appear, are often vague. Subtle changes in bowel habits, mild anemia, fatigue, or occasional blood and stool that people dismiss or never notice. Pain is usually not the first signal. Pain tends to show up later when there's obstruction, significant inflammation, or spread beyond the colon. The danger is that the disease can progress through multiple stages while still feeling normal. By the time symptoms are obvious, persistent bleeding, significant weight loss, severe abdominal pain, bowel obstruction, the cancer may be larger or more advanced. That's why colon cancer is considered a silent threat, not because it's mysterious, but because the early environment allows it to grow without causing alarms. In other words, colon cancer can be deadly not because it's fast, but because it can be quiet for so long that time passes unnoticed. Chronic kidney disease. Chronic kidney disease is a slow erosion of one of the body's most essential systems. Kidneys filter waste, regulate fluid balance, manage electrolytes, and help control blood pressure. But early kidney damage is famously painless. There are no nerve endings in the kidney tissue that reliably report scarring in the early stages, so function can decline silently, sometimes for years. The kidneys also have built-in redundancy. You can lose a significant percentage of filtering capacity and still feel fine, because the remaining units work harder to compensate. That compensation is helpful at first and harmful later. Over time, the increased strain accelerates further decline. When symptoms finally appear, they're often nonspecific: fatigue, swelling, changes in urination, nausea, itching, reduced appetite, brain fog. By then, the kidney function may already be severely reduced. The lethal part is what CKD sets up: higher risk of cardiovascular death, dangerous electrolyte imbalances, fluid overload, anemia, bone disease, and a vulnerability to medication side effects. Kidney disease is often a silent partner to other silent killers, hypertension and diabetes, quietly progressing until the consequences are too large to ignore. It's the definition of painless damage with high stakes. Pancreatic cancer. early stage. Pancreatic cancer is notorious for being quiet early. The pancreas sits deep in the abdomen, and small tumors can develop without creating a clear signal. Pain is not guaranteed at the beginning. Instead, early changes can be indirect: a gradual drop in appetite, unexplained weight loss, vague digestive discomfort, or fatigue that feels like stress. When symptoms become specific, they often relate to anatomy. If a tumor affects bile flow, jaundice can appear, yellowing of the eyes or skin, dark urine, pale stools, itching. If it disrupts digestive enzyme delivery, stools can change, greasy, floating, hard to flush, because fat is not being digested normally. Some people develop diabetes or notice sudden worsening of blood sugar control, reflecting how closely the pancreas is tied to insulin production. What makes pancreatic cancer especially frightening is that its early signs can look like common, harmless problems: indigestion, back discomfort, just losing weight, just tired. Pain may arrive later, sometimes as deep upper abdominal discomfort that radiates to the back, but the disease can already be advanced by the time pain becomes unmistakable. In short, it can be deadly because it can stay quiet while it grows in a location that doesn't announce trouble early. Aneurysm, abdominal aortic aneurysm or brain aneurysm. An aneurysm is a weak spot in a blood vessel wall that slowly balloons outward. The most terrifying detail is how often it causes no symptoms at all, until the moment it ruptures. That's the painless part. Expansion can happen quietly, and the vessel wall can stretch without generating clear discomfort. In an abdominal aortic aneurysm, the aorta, your main artery, can enlarge over years. Many people never feel it. If it ruptures, bleeding is rapid and massive, and the situation becomes immediately life-threatening. In a brain aneurysm, a small bulge can sit silently. If it ruptures, it can trigger a subarachnoid hemorrhage, often described as a sudden, severe headache, along with nausea, neck stiffness, confusion, or collapse. The danger is the gap between silent growth and catastrophic failure. There's rarely a gradual warning pain that scales up neatly. Some aneurysms do cause vague symptoms: pressure, discomfort, neurological changes, but many do not. The first symptom can be the rupture itself. That's what makes aneurysm such a brutal example of a painless threat. The most dangerous stage may be the first moment anyone knows it exists.